Flu season has hit its peak and several U.S. states have reported widespread flu activity. Here's a look at how the flu has progressed through the first week in January. The Centers for Disease Control and Prevention says Iowa and Nebraska report high levels of flu activity. South Dakota is seeing moderate levels. Health professionals continue to see the number of flu cases rise across Siouxland. And some people get so sick they have to be hospitalized, and that can create a dangerous environment for patients and staff. In HEALTHBEAT 4 tonight, KTIV's Makayla Feldman explains how health professionals are working to prevent the spread of the flu.
Fever, cough, runny nose. The flu season is in full swing in Siouxland. And whether you're a patient or a loved one, chances are you'll end up at the hospital sometime this season.
Just being in the hospital, there's always a risk of that spread of transmission.
Mercy One Siouxland Medical Center Infection Control Manager Jody Arnold works to help prevent the spread of the flu at the hospital.
Surveillance every day, you're looking to see if somebody had a diagnosis of flu or you see a result that indicates the patient has a flu and now they're in the hospital. We want to make sure that they're on the proper precautions.
Those precautions include good respiratory hygiene.
We post respiratory hygiene stands and signage, so really encouraging somebody if they are ill, they wear a mask and also wash their hands and use a tissue to contain that virus. Just really simply, if you're ill, you have signs and symptoms of the flu, please don't visit.
Arnold says those at most risk include the elderly, very young, pregnant, and those with chronic conditions like COPD, cardiac disease, and diabetes.
Those people, it can exacerbate their illness, so we really just want to make sure that they're protected and really limit their risk with negative outcomes. So everything we're doing is prevention or reducing that spread of transmission.
She stresses if you're sick, do not come to the hospital.
Obviously, people, they're ill and they come to the hospital, and our healthcare workers take care of these patients and they take care of a variety of patients throughout the day. So there's just lots of chances for that virus to spread.
For HEALTHBEAT 4, I'm Makayla Feldman.
Arnold says along with good respiratory hygiene, they also mask employees who have religious or medical exemptions. If they continue to see that uptick in the number of flu cases, they can also put restrictions on visitors.